Let's say a few words about a localization of sympathetic and parasympathetic nervous system centers. Localization. Let's make kind of table. Yeah. Let's put here sympathetic nervous system, and let's put here parasympathetic nervous system. First, we should see origin. Sympathetic nervous system has thoracolumbar origin, right? So it is a TH1 to L2, L3 segments, and the parasympathetic nervous system has craniosacral localization. Craniosacral, we have cranial nerves. Yeah, which one? The third, oculomotor nerve. It is nerve number 7, facial nerve, glossopharyngeal nerve number 9, and nervus vagus 10. Distribution. What does it mean, this distribution? You can meet information that sympathetic nervous system has wide distribution, and parasympathetic nervous system has limited distribution. But what does that mean really? What is that? Yeah. Wide distribution. You know that adrenal medulla releases epinephrine and norepinephrine. And this adrenal medulla releases epinephrine and norepinephrine into the bloodstream. And as you should understand, that blood go into all organs and tissues. Yeah. So these catecholamines, epinephrine and norepinephrine, they are coming to all cells, to all tissues. This is called wide distribution. Yeah. For parasympathetic nervous system, distribution is limited. Why it is limited? Because it is limited to nerve terminals related to parasympathetic nervous system, limited to the nerves. Yeah. Next one, ganglia. Most ganglions of sympathetic nervous system are present in paravertebral chain, so they away from organs. And ganglions of parasympathetic nervous system are close to organs, and sometimes they might be mentioned as an intramural ganglions, because they present inside the organ wall. Fibers. Now we will talk about that. So we have short preganglionic and long postganglionic fibers, and vice versa for parasympathetic nervous system. For parasympathetic nervous system, we have a long preganglionic and short postganglionic fibers. Neurotransmitters. We already said that major neurotransmitter for sympathetic nervous system is norepinephrine, because norepinephrine, it is a major neurotransmitter that released from synaptic terminals, from sympathetic nervous system fibers. It is norepinephrine. Epinephrine released, as we see it, from adrenal medulla, from here. And as we're talking about adrenal medulla releases 80% of epinephrine and 20% of norepinephrine. So major neurotransmitter for sympathetic nervous system is norepinephrine, but epinephrine also. And major neurotransmitter for parasympathetic nervous system is acetylcholine. Now we should say a few words about enzymes. Enzymes that are responsible for degradation of these neurotransmitters. Enzymes. Most likely you know that for acetylcholine we have acetylcholine esterase. This acetylcholine esterase are predominantly present in synaptic cleft and postsynaptic membrane, and it is responsible for degradation or for breakdown of acetylcholine molecules into two small parts, the acetyl part and choline part. And choline part undergo reuptake. But also we have butyrylcholine esterase. This butyrylcholine esterase present in blood plasma, and it degrades also acetylcholine, but responsible also for degradation of local anesthetics and depolarizing skeletal muscle relaxants that called succinylcholine, and genetical abnormalities related to deficiency of this butyrylcholine esterase manifest in long action of succinylcholine. If it usually acts around 5 to 10 minutes, in case of deficiency, effects of succinylcholine may last hours. And this is important to know. What about norepinephrine and epinephrine? Two enzymes we have, COMT and MAO, catechol O-methyltransferase, and monoamine oxidase. Monoamine oxidase present inside synapse, and catechol O-methyltransferase present outside. Do not think, please, that these enzymes for 100% are responsible for degradation of, not for degradation, but for termination of action of these neurotransmitters. The major mechanism of termination of action for adrenergic synapses, the reuptake. So around 80% of norepinephrine that present in synaptic cleft going back with norepinephrine reuptake transporter, and synapse use it again. But the major mechanism of termination of action in cholinergic synapses is the hydrolysis by acetylcholine esterase.